Today we're going to review heart failure, which is a very specific diagnosis, but it really just means that the heart pumping action is impaired. Before we discuss what happens when your heart is impaired, it's important to know how it works in some of the anatomy. The larger chamber you see here is the left ventricle. This is the main pumping chamber of the heart, meaning that it pumps the blood that has been oxygenated from the lungs through the aorta, the red artery here, and out to the body. Blood travels through the heart through various valves. They control the blood flow from one chamber to the next chamber. Any damage or disruption in the arteries, the chambers, the muscle tissue itself, the valves, can cause the heart to have impaired pumping action function. There are a few terms that's important to be aware of. When we talk about cardiac output, we're talking about the amount of blood that's circulated by the heart. So really, it's the heart rate, how many times your heart beats, times how much blood is being pushed out as each heart is beating. So when the heart is beating or contracting, that is what we call systole. That is probably more familiar to you in terms of blood pressure. When we talk about the top number of your blood pressure is systolic blood pressure. So that is the pressure on the artery walls when the heart is beating. Diastole is when the heart is at rest. Again, familiar to you through your blood pressure, where the bottom number is your diastolic blood pressure. That is the pressure on the artery walls when the heart is not beating or at rest. And lastly, and one of the most important terms you need to know is ejection fraction. So that's the percentage of blood that your heart pumps out in one beat. So if, for instance, your heart takes in 100 milliliters of blood and your ejection fraction is 75, then it's pushing out 75 milliliters of blood. For a average person with no heart disease, normal ejection fraction is typically 75 to 80%. For somebody who has heart disease, anything over 50% is considered normal. And problems can occur when it starts to fall below 35 to 40%. Any questions on any of these terms? So there are two different types of impaired heart function. One is when the heart muscle itself is weakened and the pumping action is weak. So that's what we call systolic heart failure. So that's when the left ventricle gets big and weak. See how it's a little thinner, it's a little bigger than the normal one. So it gets weaker, so it doesn't have that great ability to pump. We call that systolic heart failure because the contraction is not great. And then that is typically when we see a lower ejection fraction. However, there is a second type of heart failure, and that is when the heart is stiff. So that means it can't expand to take in as much blood as it normally would have. Think about it like a rubber band. A rubber band that's thin and stretched, when you go to stretch it and pull on it, it won't snap back. A rubber band that has been sitting out for a while and has gotten stiff doesn't have that stretch at all, so it can't snap back. So in both of those instances, the pump is affected, so therefore you can get similar symptoms, although in impaired heart function of the weakened heart muscle, the ejection fraction is lower, where in the stiff heart, the ejection fraction is actually normal. So to kind of quantify that for you, if that makes sense, is they both can give you the same types of symptoms, because think about a heart that can take in 100 milliliters of blood and the ejection fraction is 25%. So that means it's pumping out 25 milliliters of blood, which isn't a lot. However, in a heart that's stiff, maybe it only can expand to take in 50 milliliters of blood, and it has a 50% ejection fraction. So at face value, it seems like that should be better, but ultimately, it's still only pumping out 25 milliliters of blood. So that's why it gives you the same type of symptoms regardless of which type you have. Does that make sense to everybody? Are there any questions? So what happens when the heart pump is impaired from either side of things? So fluid builds up. And the reason why fluid builds up is because a weak heart is sending less blood to the kidneys. The kidneys interpret that as there's not enough blood, so they start to hold on to sodium and water, causing you to retain fluid, causing your weight to go up on the scale, to increase blood volume. So it's really just a miscommunication between the kidneys, the brain, and the heart that are causing fluid to be retained. So this increased weight over a short period of time is usually your first outward sign that the body is starting to have an acute problem. So this is why we ask you to weigh yourself every day on the same scale at the same time at home. And it just so happens to be the #1 reason for hospital admissions for adults in the United States. So the whole goal of what we're going to talk about today is to help you avoid going into the hospital. So what causes heart failure? Lots and lots of different things can cause heart failure. So coronary artery disease, which is why many of you are here, and valve problems, another reason why many of you are here, are a prime reason for heart failure. However, there are other things like high blood pressure, diabetes, alcohol abuse, congenital heart disease, thyroid problems that are not controlled, irregular heart rates like atrial fibrillation, and things like flu, chemo, and what we're assuming will be COVID as we gather more data. So things like coronary artery disease and heart attacks and cardiomyopathy, they affect the heart muscle tissue itself, causing the tissue itself to weaken. High blood pressure, think about it like if I handed you a weight, like a 10-pound weight to do bicep curls with. If I'm handing you that weight, if you do a certain amount, your muscle is going to get stronger. But if I tell you to keep doing it, eventually your arm muscle is going to get tired, very fatigued, and it will actually weaken. So the same thing is happening with your heart. Your high blood pressure, your heart is pushing out against that pressure. So over time, years, decades, it will cause the heart to weaken as opposed to strengthen. Things like diabetes and alcohol abuse affect the muscle tissue at the cellular level, so they can do damage to the cells, which over time will accumulate and cause the muscle tissue to be affected. Congenital heart disease and valve problems typically are impact the way the blood flows, how much pressure is within the heart, which again, similar to high blood pressure, can cause the heart to weaken. And then thyroid problems and uncontrolled thyroid problems can impact it as well, as I mentioned. And then anything viral, so flu, and that's why we're assuming over time we're going to see this with COVID patients, can again injure the heart muscle and weaken it, and just like it can weaken your rest of your systems, and chemo can be toxic to the heart muscle tissue. Questions on causes or any other thoughts or things that maybe have come up in your clinical situation? There are 3 types of medications that we typically use to help treat heart failure, and the goal of these is to improve your quality of life as well as improve the pumping action, which improves your longevity. So the 3 types have basically a goal in mind: slow, low, and dry. So you take a beta blocker, which slows your heart rate. You take an ACE inhibitor, which will lower your blood pressure and protect your kidneys. And then you take a diuretic to keep the fluid off. So those are the 3 types of main medications. Now you may be on a host of other medications for other reasons, cholesterol medication, Plavix, those types of things, other types of blood pressure meds if your blood pressure is not well under control. So these are not the only ones you're going to be on, but these are the 3 main ones specifically for heart disease. So your symptoms. So symptoms of heart failure include an abrupt increase in weight on the scale. So your actual body weight will not increase in 24 hours, no matter how many calories you eat. So if you gain 2 or 3 pounds over the course of 24 to 48 hours, there's a 99% chance that that's coming from an increase in fluid, which is an indication that something is going on in terms of your heart failure. So you want to be, that's why it's so important that you weigh yourself each day. Shortness of breath can present itself in a few different ways. It can be with activity, so it's just climbing stairs or carrying laundry. It can be shortness of breath lying flat, which we always ask about pillows. So how many pillows do you normally sleep on? Because that's important to know. And the reason why shortness of breath happens when you lying flat, if you're retaining fluid, is because if it's in your lungs and you lay down, it's going to move up higher and cause you to be short of breath. And then occasionally people, in some advanced stages, will be wake up feeling short of breath. It can also cause a dry hacking cough. You can have abdominal bloating and a feeling of sense of fullness, overfullness, or nausea with eating. Those are indications that you're retaining fluid within your abdomen. And then in similar vein, if your fingers and your ankles and your feet are swollen, then that's an indication that you're retaining fluid in your periphery. So if it's allowed to continue, you may have a loss of energy, increased heart rate, confusion, or impaired memory, or lightheadedness or dizziness. So we're hoping that we manage these symptoms before they get to these symptoms. We don't want you to get to this point. Questions on symptoms? So, in order to help you manage your symptoms or avoid a progression of any kinds of symptoms, it's important to know what your baseline is. So, what is your dry weight on your scale at the same time every day? So I say that because we are weighing you here, but there is a variability between scales to scales, plus you're wearing your shoes here, and you're also probably weighing at a different time than you normally would. So you want a set dry weight at home on your scale at the same time every single day. How many pillows do you normally sleep on? So this speaks to the lying flat issue that we just talked about. So if you normally sleep on one, and then all of a sudden you are at 2 pillows or 3 pillows, or even worse, in your recliner in order to keep the fluid, lower in your lungs and be able to breathe, that's a serious indication that there's fluid in your lungs, and you want to address that with your healthcare provider. Are you normally short of breath climbing a particular flight of stairs? So if you usually can bound up the stairs and you never have a problem, or maybe you do have to stop and catch your breath for a second or two, it's important to know which one of those it is. So if you're never short of breath and all of a sudden you're even a little bit short of breath, that's a change. If you are typically a little short of breath and now you have to stop halfway up the stairs, or you really have to sit down when you get to the top of the stairs, again, those are indications that there's something else brewing. What's your baseline shortness of breath when you bend over to tie your shoes, or how does the waist of your pants fit? Again, these are indications of whether or not you are retaining fluid in your abdomen. So if you normally can bend over to tie your shoes and it's not an issue, no shortness of breath, that's what you want to know. So if you all of a sudden bend over and then you sit up and you're and you can't catch your breath, then you're probably retaining fluid in your abdomen. Same thing if your waist of your pants are too tight in a short amount of time. Again, if your pants waist are too tight over the course of the pandemic where you've been home eating, that's different than if over a week or so your pants waist don't fit. Knowing how many grocery bags you can carry, or how full your laundry basket is, or something to that effect, is super helpful. So if you normally can carry in 2 bags and not be short of breath from your car into the house, and all of a sudden over the course of a day or two you can't even carry 1 bag, or you can't carry any, then or you're struggling to do it, then that's an indication that there's something going on. Same thing with the laundry basket. If you usually can get up the stairs with a full laundry basket, and then all of a sudden you have to stop halfway up, or you can't do it, or you've got to ask for help. Again, over the course of a short period of time, if those things are changing, that's an indication that there's a progression in the heart failure area. How do your rings normally fit? That's an indication of, again, if you're retaining fluid in your periphery. And your ankles, what do your ankles look like? And then, of course, what activities can you normally accomplish in a typical day? So if you normally can come to rehab and run an errand and go home and make dinner, and you're not overly tired, you don't need a nap, and then all of a sudden, over the course of a day or two, you leave rehab and you need to go home and take a nap. You want to be thinking, I need to keep an eye on this, what's going on. Maybe you're just getting sick, because it doesn't always have to be heart failure, but you want to be thinking about those things, whether it be heart failure, COVID, just a cold, or the flu. Things that change like that as we get older are important to capture right at the beginning and not wait and to see what happens. Because again, because of where we are right now with COVID, if we can avoid going to the ER and letting things get out of hand, that's what we want to do. So why are these subtleties so important? So if you look at this particular picture, basically what it's showing is that this is 30 days before a person with heart failure goes into the hospital. So this is the hospital. This is 30 days out. And what it's showing is that your weight and symptoms usually start, if they're not addressed and not taken care of, happen about 5 days before you go to the hospital. So you got a few days to take care of this weight change and significant symptoms if they occur before a hospital is in the picture. So the subtleties that we talked about in the last slide are important, because if we can catch it more in what we would consider this yellow zone, where you're pre-congestion, probably not showing a change in weight on the scale, but something's not right. If you can catch that here in this yellow zone, we're at day 15, let's say, before we go to the hospital. So we have a little 2 weeks to figure out what's going on, call the doctor, change of meds, change what I'm eating, report it to the rehab staff, whatever it might be, so that we can take care of it so you don't wind up with a weight change and hospitalization. This green area is actually from a device that they can put. It's an implantable device that they are using in patients who are very fragile, meaning that they're in the hospital a lot, maybe monthly, for fluid retention and shortness of breath, and haven't been able to control them with medications, and it's just a little too fragile to do it that way. So they implant this device that measures the pressure in your lungs, and they implant it, and then every morning they have to lay on a pillow. And this particular pillow will then is a transmitter, so it transmits the pressures in the lung to the physician. And basically, as soon as they go up over here, in this little one line right here, as soon as they hit that, that's when the physician will make a med change or call the patient to try to figure it out. And what they have found is that these people who we would consider frequent flyers to the hospital are actually staying out of the hospital for a year. So this is not for everybody, but this is for those fragile patients. But obviously, where these people are asymptomatic, it's just the first sign of heart failure is a pressure that goes up in your lungs, and that's what they're monitoring. Can't do that from the outside. But we can know how we feel and what's normal for us and address it sooner than the weight change on the scale. Does this make sense to everybody? Does anybody have any questions? So how do we prevent symptom progression? So what do we do if we start to notice that there's a change? So first and foremost, before there's even symptoms, take your medications as prescribed, manage your blood sugars well. As we noted before, weigh yourself on the same scale every day, and that a sudden gain of 2 to 3 pounds in 24 hours indicates you're retaining fluid. Those are all things that you should be doing to avoid the symptoms altogether. Then we want to know, and this is a good conversation for you to have with your doctor if you haven't already, how much weight over what period of time requires a call to them. So in some instances, they'll say, oh, well, first things first, if you gain 2 pounds, I want you to take an extra diuretic. And then if it doesn't go down, then call me. But you want to have this conversation with them. This gives you more control over everything in terms of managing your own situation and well-being. So, and I know a lot of you are hesitant to call them and bother them over the 2 pounds, but it's important that you do that. But if they can give you some instruction, then you'll feel less like a bother because the instruction is coming right from them. So have that conversation if you've not already had that conversation with them. Be aware of a change in your baseline symptoms. And then exercise is important. So exercise is a gauge, so if you normally do 2 miles an hour on the treadmill or level 2 on the new step and you don't have a problem, and then over a day or two you're all of a sudden struggling or more short of breath, and that's time for us to investigate as staff, to investigate what's happening so that we can look at the bigger picture as well. Also, exercise helps prevent progression of heart failure in general because it strengthens the muscles in your arms and your legs so that it's less work for your heart to do things like climb stairs and carry groceries. So, and it also helps the body utilize the oxygen that's available to it better. So there's lots of different reasons why exercise is helpful in terms of symptom progression. And then sodium restriction is very important. It's probably the biggest thing you have control over that helps prevent symptom progression. So I can't emphasize this enough. Avoid the salt shaker always. So a teaspoon of salt has 2,300 milligrams of sodium. So if you're using salt, it's very hard to stay under the 2,000 milligrams that you're supposed to be having a day. So first and foremost is avoid the salt shaker. Secondly, avoid canned, processed, packaged foods, even if they're vegetarian or vegan. So anything that's processed or packaged is naturally going to have more sodium in it because it's a preservative. So, for example, if you buy the frozen soy crumbles, those are going to have more sodium in it than if you bought a fresh block of tempeh and pulse that and use that in your stuffed pepper as opposed to, let's say, the soy crumbles. So the more you can use fresh products versus packaged products, the less sodium you're going to be taking in. Avoid high sodium flavorings, so things like soy sauce and liquid smoke. Even if they're lower sodium ones, you're going to see as we talk about food labels why that can be problematic, or reduced sodium ones. So you want to be mindful of this if you're using these. And then read your food labels. So we're going to talk about that next. But is there any questions on any of these pieces of the puzzle? So before we get to the food label, you want to think about package labeling. So a lot of times there's these labels on the front: low sodium, low fat, reduced sodium, reduced fat. You need to know that there are definitions for what defines something as low versus what defines something as reduced. And that's whether it's fat or it's sodium. So something that's low in sodium is 140 milligrams or less per serving. Something that is reduced in sodium is 25% less than the original product. So what that means is if you bought, let's say, a canned soup that is 1,000 milligrams per serving, and you say, okay, well, that's too much, I can't have that anymore. So you buy the reduced sodium version of that particular soup. Because it's only 25% less, it's still going to have 750 milligrams of sodium in it, which is still too much for you. So you would be better off looking for a low sodium version of that soup where there's 140 milligrams or less per serving. So it can be a little bit confusing, but once you know the definition, you'll know which one to gravitate toward. So a rule of thumb, you're better off gravitating towards something that is low versus something that is reduced. So here's a couple of examples of that. So here are two vegetable stocks, okay, that are both labeled low sodium, right? Here they are. One is a Trader Joe's, this one is Whole Foods. But even within the fact that they're both vegetable stocks and they're both low sodium, their sodium content is actually different. So all you can guarantee by looking at the front is that they're at least 140 or less milligrams. So your Trader Joe's is 140 milligrams of sodium per serving. Your Engine 2 is 35 milligrams per serving. Now, I'm not saying that you shouldn't have the Trader Joe's, but you just need to be aware that just because it's a similar product doesn't mean that the ingredients are the same and the amounts of the ingredients are the same. This one contains a little bit of sea salt, that's why there's a little bit higher amounts of milligrams of sodium in this one. So that's where that issue came into play. So now, where you might want to start to think about which one to use, if something that you were going to make required all 4 servings of this, then maybe you don't want to use the one with the 140 milligrams. Maybe you want to use the one with the 35. But if you're going to just have 1 serving of this, then yeah, go ahead and have that one. So you can start to tease it out as you get used to reading the food labels a little bit more. Now, this is an example of packaged versus doing something fresh. So these lentils are just fresh lentils that need to be cooked. These are a ready to eat warm, you can warm them up in the microwave, they're already cooked. So anything, again, that is pre-packaged and pre-prepared for you is always going to have a lot to a little bit more sodium. So in this case, for this half a cup, this package is quite small. Okay, so half a cup is only 5, so there's 2.5 cups in this little thing. Is 240 milligrams. I would venture to say that most of us would probably eat at least a cup of this, so you're already getting 500 milligrams of sodium, as opposed to the lentils, which this is a 1/4 cup dry, so it's a half a cup cooked, is only 10 milligrams of sodium in that half a cup cooked. So again, if you had a whole cup, it would be 20 milligrams of sodium. So it's not to say you can't have this, but you have to really be thoughtful about how you implement it into your day-to-day life. What would be better idea would be to take the time, let's say on a Sunday, and cook a batch of lentils or a batch of rice and freeze it from its fresh form, its original form, so that you have the convenience of this without the sodium in this. So just be thoughtful about that when Ashley talks about meal prepping. This is a good thing because it reduces your sodium. Questions about food labels? So to summarize, you have several tools to help you manage your heart failure symptoms and avoid the hospital. Your home scale is of prime importance. And then along with that, I gave you a weight chart. So you pull that out and you'll see that it is basically set up like a calendar. And it has a place for you to write your weight in for the day, and then a green checkbox, a yellow checkbox, and a red checkbox. So the green checkbox is, my weight is stable, I don't have any symptoms, I feel fine today. Yellow is, maybe my weight went up, or I'm a little short of breath today, or I'm a little more fatigued today. And then red is the alarm, right? Call your physician, go to the ER. It's really alarming that you're very symptomatic, weight's up significantly, things are not going in the right direction. So the job of the weight chart and the scale is to help you stay out of the red zone. So you want to use your chart. So if you're green, and then all of a sudden you got a couple of days of yellow, you want to address whatever is going on, whether it's to call your healthcare providers or talk to one of us or to take an extra diuretic, whatever the instruction were, because the idea is to avoid being in the red zone at all. As I mentioned before, your exercise is a great tool. Playing around and purchasing some new non-salt-based herbs and spices, so you get that flavor that you may feel like you're losing by not using the salt shaker. So I will say that the first week or so, when you're not using salt as much, your palate has to take time to adapt, but it will adapt, and it actually will adapt to the point when you do have salt, you'll probably be a little repulsed by it. but you have to start playing around with some other non-salt based herbs and spices. So, you know, ask questions of Ashley when you get your meal. If there's a particular flavor that you're liking in the particular meal, you want to find out what that is so that you can implement it at home. Being aware of your body. So this is where your stress management dovetails into this process. So when you're doing stress management, you're becoming very much more aware of how your body feels in general when it's quiet, when your body is quiet, when your mind is quiet. And as well, when you're doing the breathing techniques, it'll help you kind of identify when your breathing is off a little bit more. So by becoming more aware with stress management of how your body feels, you will on a day-to-day basis be able to identify when something is not what it normally is. And then lastly, really importantly, are your medications and taking them on time as prescribed, not skipping doses, and your healthcare providers. So don't be afraid to call them. Don't be afraid to ask us questions. That's what we're all here for, to help you manage all of this. So any questions? That was a lot of material, so I'm happy to answer any questions you may have on any of the slides or any of the information.